right, let's get started. Good morning, and I want to welcome you to Implementing Prevention Strategies, Applying Continuous Quality Improvement to Achieve Optimum Results with Erin Ficker. This presentation was prepared for the Great Lakes PTTC under a cooperative agreement from the Substance Abuse Mental Health Mental Health Services Administration. The opinions expressed in this webinar are the views of the speakers and do not reflect the official position of the Department of Health and Human Services. The PTTC believes that words matter and uses affirming language in all activities. We want to thank you again for joining us and provide you with a few housekeeping items. If you have technical issues, please individually message Rebecca Buller, that's me, in the chat section at the bottom of your screen, and we'll be happy to assist you. If captions or live transcript would be helpful, please use your Zoom toolbar near the bottom of your screen to enable by going into the More section, select Captions, and Show Captions. If you have questions for our speaker, please put those in the Q&A section, also at the bottom of your screen. This way, it helps us keep track of them and not lose them in a chat that scrolls by. You will be directed to a short survey link after this session, and we would appreciate it if you could fill it out. It takes about 3 minutes, and it helps us continue to improve and to report to our funders. And certificates of attendance will be sent out via email to all who attend this webinar in full, and it can take up to 2 weeks to receive those certificates. If you'd like to know more about what we're doing or information on upcoming events, please see our social media pages. And now I'd like to turn things over to Erin, and she'll introduce herself and we'll get started. Erin, you are muted.
Good morning. Thank you all. I'm sorry for the mute. My name is Erin Ficker. I work for the Great Lakes PTTC and have been in the prevention field for about 18-ish years and have been working with community level and state level prevention providers on all manner of topics, including sustainability, the SPIF process, strategic planning, and in the past few years, quality improvement. So I am here in Chicago, Illinois in Region 5. And so I'm happy to see so many Midwesterners in the chat. So thank you for introducing yourself and letting us know where you're at. I want to get started today because I have so much and I'm so excited to share this with you today. So I'm going to go ahead and get us started. So today we're talking about implementing prevention strategies and applying quality improvement to achieve your optimal results. Really, we're just going to be talking about how do you do good quality improvement and apply it to the prevention work you've been doing. So our path for today, we're going to talk a little bit about what CQI, continuous quality improvement, is. We'll talk about some of the approaches and then how it applies to the strategic prevention framework, which is the strategic planning model we use in prevention. We'll also kind of dig into some strategies and how we apply those CQIs to the prevention strategies that we're doing. So we'll go through some examples, we'll kind of get into some tools, and hopefully we'll leave you with some resources and some ideas about how to move forward. Before we do that, I really want to know a little bit about your experience. So I'm all ears. Tell me about your experience with quality improvement. What, if any, have you done or have you been a part of in your work? And you can just throw that in the chat, whether it was formal process or informal. What has your experience been? No experience with CQI? That's great. Brand new. Wonderful. Informal? Absolutely. I think prevention does a lot of informal. Oh, we have great. Kathy's had some formal training. That's wonderful. Yeah, a lot of us have had informal training. A lot of us are actually doing quality improvement, but don't don't call it that or don't have a formal process. So we're going to talk about that today to kind of dive in. So it's good to know we have a lot of people who have done some informal quality improvement work, and we're going to dive into doing some conversation about how to make that more formal. Okay. Always working, someone said, oh, we're always working on program development and creating our own prevention programs for child pregnancy. Yep, so you're always working, trying to improve. We'll talk about that. Great. Okay, I'm going to keep, oops. So one of the things I want to do for my own kind of measurement of how well this training works to get the information across is we're going to do a little quiz. It's not about you. It's not about what your certificate is not related to it, but we're going to put up some questions and ask you to answer them. You'll have to scroll down. Nobody else can see your answers, but just take a minute to answer these questions. If you have to jump off this webinar early, which I would encourage you not to, because it's only going to get better as time goes on, I encourage you to, or please don't take this, because we're going to look at the statistics for our own use. So it's helpful for us if you know you're going to be on for the whole time, please do that. So you should be able to scroll down, and there are 4 questions. Continuous quality improvement requires a team. True, false, I don't know. You should only make one change at a time during an improvement cycle. True, false, I don't know. The A in PDSA stands for adopt, act, abort, apply. Or, and the last one, process evaluation and quality improvement are the same. True, false, I don't know. So just take some time to answer those questions. Again, this isn't a test. We're not gonna judge you on it. It's just helpful for us to know as we move through, but it's also helpful for us at the end. So we know if we were able to impart that information. Okay, and Rebecca, just let me know when people have had a chance to do that.
I think we're getting close to 85%. You can go ahead and I'll leave it up
Okay.
for a little bit.
Oh, perfect. Thank you so much. I am good at this. So as you come in, if you just take the minute to do that, or as you're thinking it through, please go ahead and finish that up. And I'm going to keep us moving. So some of you said you're new to prevention. Some of you have been in the field for a while. The one thing I think we can all agree on is that prevention is dynamic. It is always changing and always moving, and in multiple dimensions, right? So we know that prevention is changing because use patterns change, emerging drugs and trends in alcohol and drug use change. We know that risk and protective factors in our communities are dynamic and change. One of the things that can be maddening about prevention is that we can address one problem and then only to find that it springs up in another place, kind of like putting our finger in a dam, having it come out the other side. We know that it just keeps moving and changing. We also know that the science of prevention is dynamic and continues to change. So what works for certain populations, what works, and how substances and how our programs work with different substances and populations. We are always learning and growing and changing. So it's just a dynamic field, which means we need to be able to pivot. We need to be able to change without hesitation and as seamlessly as possible so that we continue to grow and protect the changes that we've made in our communities. So I'm good at slides. Let's talk a little bit about what continuous quality improvement means, right? So if we're in a field that's always changing, we need to be always changing. We need to be dynamic. We need to be able to pivot. But one of the ways I purport that we should do that, and I think that we should start thinking about, is through the use of continuous quality improvement or quality improvement or process improvement, whatever we want to call it. But what it is at its root is it's a planned approach to transform your program, your organization, your team, your work, and improve systems to get to better outcomes. In prevention, we are so focused on outcomes. So we are looking at this as a planned, thoughtful approach. There's probably a dozen different definitions we can look at. Some of the ones I enjoy the most. The Centers for Disease Control and Prevention talk about it as a continuous and ongoing effort to achieve measurable improvements in effectiveness, efficiency, performance, accountability, outcomes, uh, indicators of quality, right? All of the things we want to make sure can continue to grow and change. So you can see how it's continuous. There's all these different ways we can apply, change, or think about efficiency and effectiveness, performance. Excuse me. Another good definition that I often refer to is that it's a systematic and continuous approach that leads to measurable improvement. So you'll notice that it's all about planned, it's systematic, it's formal. So quality improvement really needs to focus on using a planful process. And in prevention, again, this is something we do. We know how to do things in a strategic and planful manner. I could go on. I could list more and more and more definitions. But again, what you're going to continually hear as you get into this field and you research is that it's deliberate, it's defined, it's specific, and it's focused on improvement in multiple dimensions of our work. So oh, slides move forward. So if that's what we said that we kind of informally do this. Prevention is focused on improvement and outcomes kind of naturally in the way that we structure our work. But why do we need a formal process, right? Is really the question. Why do we need to know specifically, excuse me, why do we need to know how to use a specific process? Why do we need to do this in this planful way? And it's pretty straightforward in that, have you ever been in a meeting and there's someone new in the room and you're trying to solve a problem and someone says, oh, well, we could try changing that one piece. And everyone in the room goes, we tried it, didn't work. Did you try it? Why didn't it work? What didn't work about it? Can we talk a little bit about that? Often what we do is we try things in an informal way. We don't measure it and we don't document it. So formal quality improvement documents the work and changes that we test. It helps us identify what doesn't work. So when we say to someone, oh, we tried that and it didn't work, we can say because and why and how and what we did instead. And it's really focused on a kind of a continuous feedback loop, which is, again, something in prevention we try to build into our work naturally. So it's formalizing and documenting. I think one of the most useful components of it in the application of prevention is around the documentation of how things change and identifying what the little changes are that can get us to better outcomes. And sometimes they're just so little, and sometimes they're really big changes. It also helps us really stay focused on quality. It's easy for us to implement a program, it's going well, and just kind of go into autopilot. The idea of continuous quality improvement is that we're always looking at quality. We're always trying to say, is there a way that we can do better? Are we happy with these statistics? Are we happy with how things are happening? So we really think about it in that way. It's data driven, it's well documented, it's planful. It helps us identify what works and what doesn't work and creates a structure for how we think about those changes. So those are kind of the key benefits of using an official or a structured approach to continuous quality improvement or change manager, whatever you want to call it. And we'll call it a dozen things through the course of the next hour we have together. But what other benefits might you expect to see from using a formal process? What brought you here today, and what do you think What are you hoping you might get from learning this process? And you can just write in the chat, what do you think might be other benefits? What works best, right? I said it helps us identify what doesn't work, but also what works best. Not becoming stagnant. I love that, right? So it's easy to just become complacent or stagnant in our work. And this really forces us to keep pushing, to keep looking at how the field is changing, how we're changing, how our work is changing. Budget justification. Oh my gosh, so smart, right? So if we can show that we are doing things well, or we need more budget to do things better, or we're spending our money well, here's how we're doing it, and we've continued to improve. It definitely supports our grant work. Um, it supports how we sell the work to people if we can show that we're continually improving. To keep changing with the community. Our communities are dynamic. Like I said, they keep changing. So you're right. It helps us change with the community. So when we find that, there's a change in, for example, um, where where the place of last drink, right, which we know can be an issue. If that starts to change, then we can change our strategies and we can test small changes here and there. So it does help us move as things change. What's been working? Better bang for the buck. I love that. Better results. Show funders the quality of your service. Right. So show them that you're not just phoning it in, right? That you are focused on improving. How you can streamline things. That's that efficiency piece, which I think is important when we work with limited funds. You guys, these are all great. These are all absolute benefits of using a formal process. And I'll say again, what I hear here is a focus on quality and documentation, right? And that ability to pivot, right? Having a process in your pocket that you can pull out and be like, we need to make a change. So great. Um, I'm going to keep going because I want to dive a little bit further into this because we know why we want to do it. Prevention uses a strategic approach. We've used a strategic approach for a very long time. It is the foundation of how we identify and do our work. So we use the strategic prevention framework. We go through this process. We're used to using formal documented processes. And so a strategic prevention requires that we use a strategic approach to improvement. And it's something in the field that we just haven't done yet, right? Maybe we're so focused on the amount of work that goes into this BIF, we haven't spent this time to say, let's talk about strategic approaches to improvement. So we're people who are used to thinking this way. It's not as hard as it's going to be because we're so used to this. So for those of us who've used this BIF, who continue to use this BIF, what we'll find is that it's a natural transition in our thinking. It's a natural way for us to think about change. Okay. Ah, no, I'm not good at slides. Sorry, people. So quality improvement models, there are a million. Does anyone know any? If you know any, throw them in the chat. Quality improvement, it's called continuous quality improvement, continuous process improvement, quality improvement, QI, CQI, all kinds of different terms that we use for quality improvement, but it's basically an umbrella term for this formal process of improving our work. Really, the formal approach started uh, in business, right? It started with industry and manufacturing. Edward Deming was kind of the grandfather, if you will, of quality improvement, and really was focused on how do I make more widgets better, faster? What's the part of this system or this process that I can change? And how can I do that in a planful way? So they started with business, started with manufacturing. It's been adopted by companies across the globe. There's a number of models that have all kinds of crazy names, like the lean model, the Six Sigma model. There's the model for improvement, all of which have been applied in different ways. But about, I want to say about 30 years ago-ish, healthcare started to say, you know what, we could take these tools and make improvement and changes in people's lives and in healthcare. And so they took this business model and started to apply it to healthcare. And that's where we started to see the improvement guide, which comes out of the Institute for Healthcare Improvement, or IHI. If you ever go looking for information about CQI or about quality improvement, you're going to find this real quick. The improvement guide is focused on healthcare, but it focuses on one very specific model, and that's the model we're going to follow today. Taking a business model like the Toyota model or the Six Sigma model is a little bit more complicated. And what I like about this is it's a bit more straightforward. It has already been applied to healthcare settings and to social service settings. So I see people saying PDSA and SMART. These are components that we're going to talk about of models. So I'm going to show you that I have my trusty copy of the improvement guide here with me. And we are going to use this really simple and powerful approach to quality improvement because it's really been the model that's being implemented in social service, in nonprofits. It's kind of the model that's been most accepted and used in that setting. It's a model that you don't need to have a formal team for. So I think that's important to remember too. We don't need a full quality department to do this work. So that's one of the reasons I like this model. So that's the one we're going to be talking about today. But we want to talk about what CQI really requires of us. It requires that we're curious. No matter what model you use, no matter what field or industry you're in, you want to be asking those questions of how are we doing? How's it going? And what can we do better? Can we be more efficient? Can we be more effective? Can we get it done faster? Can we get more people here? Can our work be more impactful? So it requires this curiosity and openness to change, which can be difficult. Difficult because it challenges us, but also difficult because it takes time, right? So how many people have said like, oh, yeah, I don't have time to think about how to do things better because I'm so busy with what I'm doing. So this is one of my favorite little quality improvement jokes, right? We're too busy for change. So no thanks. I don't need the wheel. Fine. I like it this way. It's always worthwhile to invest in change. The cost benefit is there. So spending the time to look at ways you can improve and applying that is going to pay off. It's going to take more time, but it's going to be worth it. You're going to get the wheel, you're going to move that cart faster. So it takes curiosity, it takes time. So I encourage you to just remember that we're open. We're gonna carve out time to do this work within the work we're already doing, right? Because we have so much time. But it's important that we find that time. Okay. And the components of it, right? So we have to have all this time to do this, and we have to have the curiosity, and then there's a structure we need to start with. So almost every model of improvement, almost every approach to quality improvement has a set of kind of key components to running a change project. So you'll hear me use the term change project, and I'll explain that a little bit later, but whether it's a change product or a formal quality improvement process or a formal continuous quality improvement efforts, there are things that we know we have to do. One, we have to form a team. This isn't work you should do alone. It's not work you should do in your office by yourself. You need a team, and it should be comprised of people who are impacted by the work, who do the work, who fund the work maybe, or who oversee it. You're going to want people involved in the improvement team who have the power to help make change, right? So you're going to want folks in the organization who maybe are a little higher up than you that can green light change for you, who can maybe give you a little bit of leeway. You're going to want people who have the lived experience in the program to say why something's working or not working. You want those folks who are implementing programs, those folks who are giving out naloxone in your naloxone distribution program, or who are educating teachers on the implementation of youth curriculums. You want people involved who have experience with the project. And again, not just administrators who oversee the work. You have to establish objectives. So your objective is to improve. If you're doing a discrete project, just, we really want to increase participation in one of our programs, or we want to make our mentoring program better, you're going to establish the objectives about what you want to do. So what are we trying to accomplish? It should be specific, and we're going to get into kind of the how do you set that goal in a little bit, but you have to have an established objective before you can go very far. So your team will do that together. So from this point on, you're working with that team, right? You're going to establish measures. That's our third one, establish measures, because we need to know how much we want to improve, how we're going to improve, and how we're going to know it's an improvement, right? How will we know that it's better? And those are the measures, which again, because so much of prevention is data driven already, it's something we're pretty comfortable with, is identifying and using measures. You have to select a change. So, you have to decide how you're going to, what you're going to apply, what you're going to do differently, and then test it. So you'll test it. And this is where I think sometimes quality improvement and the way we think about prevention can be difficult to align, because when we say test change, we mean we're going to try that change in a small environment. If we have 5 schools where we're doing youth prevention education, we're going to test this change maybe in 1. And then if it goes well and our data shows us that it goes well, we're going to implement that change. And when we say implement, I don't mean broad implement. We're going to implement it in different settings, right? We're going to try it out now in maybe 3 or 4 of those schools, maybe that are a little different, have different populations, different grade levels, different experiences with the administrators, to make sure it works in different settings. So that's that kind of implementing the change in different settings. And then we're going to spread the change. So that's kind of the final component, is spreading the change to say, okay, it worked. It worked in multiple settings. Now let's get it out there, right? So those are that kind of that process, or those components of a change project. So you have a team. Oops, sorry, not good at slides. The components of change, right? So you have a team, objectives, measures, and then you're going to test, implement, and spread. And that's kind of the basic framework for where we're headed. I mentioned the model for improvement before, and I'll show you my favorite book again. You'll see mine is dog-eared and all the places where I like to go back for references. So the model for improvement is the one we're going to talk about. It is really straightforward. And if you go on the internet, don't do it now because I'm still talking. But if you search for, and we'll provide you some resources at the end of the webinar, for IHI, or the Institute for Healthcare Improvement, they have online guides for how to help you do this. So I encourage you to seek that out. And the reason we're going to do it is, 1, it's easy, it's accessible, and it comes in this approach where we look at it in this 2-step piece. And this is the image you will see time and time again, which is, what are we trying to accomplish? How will we know there's a change, that the change we make is an improvement? And what change can we make to get to that improvement? So those are those 3 questions. And then we use our testing cycle. Excuse me. So the model for improvement is made up of these 2 components: guiding questions and a testing cycle. Again, this is the kind of the simplification of what can be a complicated process, but doesn't have to be. So we're going to dive into these guiding questions and testing cycles that we use in the model for improvement. But I want to just pause for a second and ask if there are any questions before I go any further. Oh, darn it. Any questions, thoughts? No? Okay. Well, let's get into these two parts then. I'm watching the Q&A. I'm trying to watch the Q&A. I'm definitely watching the chat. So if you have a question, put it in the Q&A and we'll make sure to get to it. So we'll start with the guiding questions. And there are three guiding questions that are specific in the model for improvement, and they are aim, measure, and improve, right? So these are the questions that are going to get us there. Okay, so the first question we ask, is what are we trying to accomplish? And it may seem basic to say, what are we trying to accomplish? But you need to make sure that that team that you've brought together are all on the same page with what we mean by what are we trying to accomplish. So are we trying to expand our retail beverage server training? Are we trying to increase the number of community members attending community meetings? Are we trying to expand our youth coalition? What's our aim? What are we trying to do? Ultimately, the strategic prevention framework helps us identify our big aim. And in that planning phase, we decide what we're going to do. We're going to reduce underage drinking by addressing this particular risk factor. When we're talking about quality improvement, we're going to get into those programs. We're going to be kind of in the heart of the implementation phase. And we're going to be talking about these programs and what are those changes. So it's important that you ask this question, which is what are we trying to change? And that's where we get into our aim statement. And someone mentioned earlier in the chat, excuse me, SMART goals. So a SMART goal is specific, measurable, achievable, relevant, and timely or time bound, depending on how you talk about it or how you've heard it used. Same thing. But we've also added inclusive and equitable. So they're not just SMART goals, now they're SMARTY goals. And let's talk about what that means. So specific, what do you want to achieve? One of the models we use of quality improvement talks about the 5 whys. So what, why, who, when, and where. So make sure you're specific about what you're doing, why you're doing it, who's involved, when and where and why. The measurable we know is a clear metric, a benchmark. How will you know that you've achieved your goal? So this is that we're measuring it. How much or how many? So those are the questions you want to be answering in that M of your SMARTY goal. Achievable, you want to, right? You want to be able to accomplish this. You want to be able to make the change. You want to be able to see that improvement. You don't want to do something too easy, and you don't want to put out, something well past the goalposts. So you want to think about what's maybe a stretch, or maybe a little bit of a stretch for you, but still achievable and something that you and your team can work towards. Relevant, don't try to change things. Don't try to aim towards things that aren't related to your work or that are not specific to your overall objectives. So it's I know it sounds silly again, but if you're wanting to increase the reach of your school-based programs, you want to make sure that your goal is relevant to that work, right? And that the change or the goal that you're seeking would lead towards that change, as opposed to, or that improvement, as opposed to, oh, well, we really want to expand our school-based programs, so we're going to increase our coalition membership. Well, that's not really relevant to the goal. So we're going to think about it being relevant to our work, relevant to relevant to our improvement. Time bound, when are you gonna do it by? Make yourself accountable. It's that simple. How will you know you're getting there? How will you track and how will you know when you arrived? So this is where we get to these two new ones, right? That I love, is inclusive and equitable. And this is something that we haven't had in our goals in the past. And so I'm not going to spend a ton of time on it. We'll talk a little bit, but I'm going to point you to some really great resources that that you can go to find out more about these, and I'll share those with you at the end. But inclusive means we're bringing the most impacted, the people who are most impacted by the process or the activity or the change into the process, and sharing the power of the decision making with those individuals, right? That we're making sure that we are inclusive in our work. So how are you going to include disproportionately affected people? Thinking about decision making and power sharing. So you're not just asking them what they think, you're engaging with them in a way that they have equal and shared power. Equitable is making sure that there's an element of this goal that is seeks to address some systemic injustice, oppression, or gets to those social determinants of health that are impacting the populations that we're working with, right? So how will you include that element of fairness and justice? So for example, I'm going to give you some examples, and I'm going to see if I can do this. Oh, I don't think I can. I was going to try to put this in the chat, but I don't think I can. So if I say my SMART goal is I want to extend the length of our youth mentorship matches by 3 months by the end of August. So I want to make those matches be 3 months longer, and I'm going to try to do that by the end of August. That's my SMART goal. It's specific, it's measurable, it's relevant, it's time bound. It's achievable. We can do that. We can extend it by an additional 3 months. But if a SMARTY goal needs to also think about how are we inclusive and equitable, I would expand on that and say, I want to expand my youth mentorship program into, expand my youth mentorship program. Oops, nope, that was the wrong one, sorry. Extend the length of my youth mentorship matches by 3 months by the end of August, with a change team, including youth, former and current mentors in schools and communities with identified low community connectedness, right? So that's where I'm being inclusive, making sure that the right people are at the table and informing the process and the decision making, and that we're focusing in places where this work would make our community more equitable. So I really, I thought I could cut and paste out of here, but I can't. I can't. So I'm really sorry. I will put these in there for you guys later. But there's a number of really great handouts and worksheets out there that you can use to kind of get the hang of adding this equitable and inclusive. So those are our SMARTY goals. We start with this question in quality improvement that is, what are we trying to achieve? Okay. Oh, I'm good at slides. Okay. The next one is around measurement. How will we know the change is an improvement? And again, we're good at this in prevention. We're good at data. We do it a lot. So how will we know this is an improvement? So we set out our goal. We know what we want to improve, but how will we know it's an improvement? And that's where we get in with data. That's where we start to talk about measurement. So outcome data, right? So are the outcomes changing? Process data, what's happening inside of the processes, and then what we call balancing measures, which is, so for example, if this is a great example of a quality improvement gone wrong. So after a very serious boating or a shipwreck, a ship goes down, hundreds of lives are lost because they didn't have enough lifeboats. So they make a rule and they say, we need to improve this. We're going to make a rule. They made a rule to say there needs to be a specific number of lifeboats to match the number of people on the boat. Okay, great. So they do that. They put the boats on, they put them on there. They send people out there, all their lifeboats and all the people on the boats. The balancing measure is, did something change that we didn't anticipate? Well, it turns out a strong wind took down an entire ship. This was on the Great Lakes. The entire ship went over in a wind that normally would not have caused a shipwreck or any problems, because they didn't balance or take into consideration the weight of the additional lifeboats. So we want to think about making sure the change we make doesn't take away, doesn't add burden, it doesn't change the balance of the boat, It doesn't change or make things more burdensome or, create other conditions that um, that balance out that improvement. So if we see an improvement, but we also see a change that we didn't anticipate, we need to think that through. So you want to think about what are some balancing measures. Sorry. Okay. A lot of things we think about are a lot of the good examples around balancing measures you'll find when you get out there to do some more research are around healthcare. So we want people to wash hands more often. Well, now it's taking longer. We've got dry hands. Okay, so now we need to like get some lotion in there and we need to find a different way. So there's all these different things that we make an improvement and then we need to make an alteration to it. So those balancing measures, the process measures. Okay, it's taking more time. Is that worth it? Because the outcome data tells us yes, we're seeing a reduction in unintended infections. So again, these measures are going to tell us along the way how we're doing. And then that last question is what's the change we're going to make? Okay, so we know we want to have longer mentorship matches. We know we can measure that by the length, the match, we can do interviews. All of the things that we have in place and maybe add some others. Does this mean that we're not getting mentors because we're asking too long of a commitment? What's the balancing measure there? How will we how will we make how will we make a change? So what's the change I'm going to make? And there's all kinds of options. So this where we're going to get down, we're going to bring that team together and we're going to ask this question: what change can we make to get to this improvement? That's why you need to have an inclusive team. That's why you need to be thinking about that SMART goal: is what's the change? What's not working? And it can be something really small or it can be something more substantial. So
And Erin, there's a question here of, could you reiterate the difference between process and balancing measures?
oh, sure. Oh, thank you. Yeah, thank you. I went through measures really quickly. I apologize. Um, the difference between a process measure and a balancing measure. So a process measure is something we're going to measure along the way to see how things are going. So if we say we want to increase mentor matches by the end of August, along the way, we're going to collect process data to find out, are mentors meeting regularly? Are mentors staying? Are appointments getting canceled? Are we able to recruit at the same rate? Things that are, the recruitment actually is a balancing measure, sorry. So how is it going? Those are the same kinds of process measures that we would look at, like how many people are attending our parenting programs, how many people are coming back for a second session, how many people are completing the program. So they're not that outcome, which is I wanted to change parents' attitudes, understandings, and actions. They're the how many people are there, how many trainers do I have? It's a lot more about the kind of the counting of what's happening. The balancing measures are those things that were not intended or might counteract the change, right? So it's we moved, for example, we moved the time of a parenting program because it worked better for people's work schedules, but now we have a childcare problem. Now people aren't coming for another reason. Or now we our facility isn't open that late, so we have to change locations, right? So it's really more watching for measures that would throw things in the opposite direction, right? So it's not improving. I don't know if that's very clear, but balancing measures are usually things that kind of come up along the way that you just need to be tuned into all the processes that are going on. Does that help at all? I know it's a complicated. Okay. So I want to talk a little bit about identifying the way we test changes. And again, this is where, like I said, your team is going to be super, super important to you. Identifying changes and answering that question, which is what can we do? What change can we make to meet our improvement goal? Involve people. This is like, of all the research that has been done by all the people in all the places, in all the fields, in all the dynamic directions we can make change. This is the most important thing. You have to be able to include participants, partners, people who are impacted and who are doing the work. Otherwise, I mean, you really, you're going to miss the mark because you're not going to make change in an informed way, right? So we want to think about including those folks. We also want to examine the systems that are in place. So like what are the current systems? So there's an expression that says every system is set up to get the exact results that it gets, right? So if we're not getting parents to come to a second, third, fourth parent program that we're running, we have a system that's set up that's doing that, right? So how can we change that system? So we want to look at things like flowcharts and diagrams. There's all these ways and tools, and I'll point you to some of those resources where they have worksheets and workbooks that are really awesome that talk about, fishbone diagrams, all these great things that help you kind of look at your system. We also have a Change Leader Academy that I'll talk about at the end that you can go through that talks a lot about how do you examine your systems. So for example, parents aren't coming back. Well, we talked to some folks because we involved them. We found out it's because, parking is a real pain. So, okay, let's look at the system by how do people drive here? How do they get here? How do they find the parking? And then see if we can look at a best practice for changing that. And don't stop at one idea. Just, you can use a formal facilitated process. You can brainstorm. You can have people all different ways you can brainstorm these ideas, but don't stop at one idea because you're not going to make one change. You're not going to test one change, and that's not going to be the only thing that fixes the problem or that improves the program. So you're going to want to look to best practices in the field, examine your systems, involve everybody who's impacted by this, by the need for the improvement, and then just generate ideas, right? We're not going to take anything off the table. So those are those two that, the guiding questions. That's setting us up. What are we improving? How will we know it's an improvement? And what are we going to change to get to that improvement? Are there questions about the guiding principles before I move on? Okay, then I'm going to jump into the testing cycle. And this is the fun part. Someone mentioned this already, the PDSA cycle. So this says NIATx. We have the University of Wisconsin has a really great NIATx system. It stands for, can't remember, but it's a process that was created specifically for treatment that we've applied to prevention. But the PDSA cycle is widely used. And we're going to walk through it a little bit by a little bit, but you have probably heard about it. You've probably seen it. You probably do it and don't know it. So we're going to walk through this PDSA cycle, and we start with plan. We do, we study, we act, we rinse, repeat. You see, it's a cycle in the same way that the SPIF cycle is. Okay, oh, I'm so hard. Okay. What will happen if we try something different? Okay, so we're going to plan. We're going to talk about asking this question, what will happen if we try something different? So we've already decided that we have all these different ideas for change. What's going to happen if we put one of those changes into place? So we're going to make a prediction. This is kind of scientific and fun, right? It's like biology class. We're going to make a prediction. What's going to happen if we make that change? How or who needs to be involved? So how is this going to, literally, how is it going to happen? How are we going to increase the parking? How are we going to get parents to the right location? And then we're going to determine the measures, right? So we're going to say, okay, there is parking. People can't find it. We're going to put out a sign that says, here's where, the parking is. So what we'll do is say, drive you right to that. The measure will be how many people come back. And when they walk in the door, we can say, hey, did you find the parking okay? That's a measure. Do people come back? Do they get there on time? Is the parking becoming easier? So we're creating the plan and determining those measures. And then we're going to do it. We're going to put out a sign. We're going to test it for 3 weeks, see what happens, right? So we're going to implement the change and gather the data. This is just the doing part of it. And then we want to know what happened, right? So what did we learn, right? Did it work? We're going to look at those questions. When we casually ask people as they walk in the door, were you able to find parking okay tonight? Well, we're going to make some notes about that because this is a documented and strategic process. We're gonna say, well, we thought that people would show up on time and that they would come back more because it would be easier to get to. Is that what happened? We're gonna compare our prediction to what actually happened. And then we're gonna summarize those findings and bring our group back together and say, okay, so this is what we saw. What do you guys think? Right? So we're gonna look at that and say, well, we did see an increase. We did see more people coming back, but it didn't get to where we wanted to go, or it did get to where we wanted to go. We're really happy with the results of that. So then we have to do what's next. What are we going to do? And this is the act step. We're going to act. We're going to move forward. So are we going to adopt the change? Are we going to adapt it? Are we going to abandon it and be like, that didn't make any change? Or it was too much work. We spent way too much time putting out these signs, making these signs, and we got 2 more people. Well, that's not worth it. We're going to abandon that. And then what's next, right? I said before, we're going to make a big long list. We're not stopping at one change. So what's the next change we're going to test, right? That's the cycle. And that's why we call these small tests of change. We're going to test little things and see how they go. And we're just going to repeat, and we're going to repeat. We're going to repeat and repeat and repeat. We want to keep trying to get better, right? So it may be that we try to put out a sign, and that works a little bit. So let's put out a sign and put directions in an email before the event. Let's do that, and let's try also to text people. Let's also offer coffee and donuts. So there's always changes, and we don't have to test them one at a time because we're going to have specific measures. We're doing small tests of change. This isn't a scientific process that we're, trying to have a control group. We're trying to improve our work in real time. So it's okay to test more than one thing at once and kind of keep these cycles going and going and going. And it's exciting and it's fun. So that PDSA process, I walked us through it fairly quickly because I want to kind of dig into what it looks like, but I want to stop and ask, are there questions or thoughts or insights? So I see in the chat, so we're breaking that if it ain't broke, don't fix it. Absolutely not. If it's not broken, don't fix it. Don't. If you're not getting what you want, if you're getting 75% of parents returning for 4 of 6 sessions, that's no good, right? We want to see 90% of parents getting there because the more parents we get there, the more likely we are to reach our ultimate outcomes. So we're not just making improvements just for fun. And we're not just doing this in a continuous way just to keep it going. We're trying to reach that outcome. If we reach the outcome, then and we adopt a change or 2, perfect. But we absolutely we don't want to mess with things that are working, but we also want to make sure that we're asking ourselves that question: is it really working? Could we do it better? So it may not be broken, but is it as effective or efficient as it could be? And I think that's the way we need to think about this work, right? We're not fixing something that's broken, we're improving something that we're doing. Is that helpful? Okay. So I have a question here. Are there specifics on the documentation that should accompany a PDSA cycle? I've seen some tendencies saying, we're following a PDSA cycle informally. I love this question. I have some tools for you, and we have a worksheet that's on on the products page that I think has been in the chat a couple of times now that you can download. You can also kind of find a tool that works for you. There's no real specific, like you have to do this type of documentation 1, 2, and 3, but the documentation is the part that makes it powerful. So you're right. People are like, oh, I informally do a PDSA all the time. But if they're not actually, if you're not actually documenting it, that doesn't become institutional knowledge. That doesn't stay with the program, and you're going to keep making the same mistake, right? So, for example, I worked in an organization, and we had these weekly meetings that it just became they became unuseful, right? We had too many things to talk about, so we weren't focused. And so we thought, let's break this into 2 meetings, right? This meeting's not working anymore because we're trying to cover too much content, we think. Let's break it into 2 meetings and have an administrative meeting or programmatic meeting. We'll meet twice a week. We did that for a while. It was just too burdensome. The balancing measure was like, we can't meet this often. This is a pain. And so we stopped and we went back to 1 meeting. And about 6 months later, we were like, this meeting doesn't work. We had a couple new team members who were like, you guys, this is too much to cover in 1 meeting. We never wrote any of that down. We were like, wow, why did we stop doing that? So it was a really small change that was impactful to our efficiency and our effectiveness in our work. And we tried it, but we didn't write it down. We didn't document it. We weren't explicit. And in not being explicit, we made the same mistake again by going back to how things were, not studying, making a decision and trying what's next. But we also lost that knowledge and we made the same mistake again. So hopefully that answers that question. Little documentation is fine. Big documentation is great, kind of depending on the type of change you're doing, the number of people involved, that kind of thing. So there's lots of great tools out there, and there's some tools that we'll share with you. Okay. I'm going to keep going because I want to talk about how this fits into the SPIF, right? So we all are familiar with the strategic prevention framework and the framework that we follow as part of our work in prevention to make sure that we're being data driven, that we're focused on evaluation, that we're doing great work. And the examples that I've used so far are really specific to implementation, and I'm going to give some more examples about implementation later, but quality improvement fits into this whole thing. We're data driven, right? This field is a data driven field. We pride ourselves on having that mindset and that approach to having process data, evaluation data, making decisions based in data about what we're going to do and how we're going to do it. And then we take that, we can take that mindset into quality improvement. That data-driven approach, we're going to take it in there. And for those of you who've worked the SPIF, who've been through SPIF trainings, you know that you get into that implementation phase. You spend so much time talking about assessment and planning and capacity building. And then you talk about implementation, and they're like, okay, so then you're going to do implementation. You'll see how it's going to do some mid-course corrections and then get to evaluation. And we really breeze through this idea of mid-course correction, right? I can't advance slides. Okay, there we go. Sorry. Of mid-course correction, right? We talk about it, but we never talk about how to do it. And I think the best place, the easiest place to really think about how quality improvement fits into the SPIF is an implementation in this concept of mid-course correction, meaning things aren't going the way we thought they would. Let's make some change. That being said, I think it's important to note that process evaluation and quality improvement are not the same thing. Process evaluation is determined before the project starts. It's conducted by either an independent or an internal evaluator. It's conducted kind of externally from the program, and it answers specific programs about how the program is going. Quality improvement is conducted by those folks who are involved in it. It's more focused on how well the program's being implemented, and it almost always is going to focus on process or system, right? So how we do the work as opposed to how the work, how the outcomes come through. I just wanted to say that because I think it's important. We're not doing quality improvement because we do process evaluation. And by doing quality improvement, we're not doing process evaluation. They are different, but they are also kind of connected. And sometimes going into our work with a process evaluation plan, that data can help us in our quality improvement work and that mindset. So we have for you, and I'm going to show you what it looks like, but, and again, links in the chat. We've created a worksheet for you on how to kind of walk through this process. So the PDSA worksheet talks about the 3 fundamental questions here and the steps of the PDSA cycle, which I kind of just went through. It also gives you a place to talk through those fundamental questions that aim, measure, and change. To document that, and it also gives you a place to document your PDSA cycle. This is a great tool, I find, to use as a team, to use to just kind of either jot down those changes or use it as in a bigger way to document your change. And you can just do as many of these cycles as you want, but this is just a nice little tool to help you go through that process as you begin this work. Okay, so let's do one together. What's our aim? Okay, what are we trying to accomplish? So here's my example. Yeah, you will get a copy of that, Kendra. It's on the products page, and they'll put a link in the chat for you. So what are we trying to accomplish? Let's say we want to increase regular attendance, at least 80% of participants in parent education programs from 55 to 85% by the end of the second program cycle. So we're in 2 cycles. By the end, we want to see that increase. Now you'll see this is not a SMARTY goal. I had forgotten to add how am I going to do that in an inclusive and an equitable way. So I apologize I didn't make that change in these slides, but we would do that by ensuring that we're including participants in that program in the decision making, and making sure that we're doing those in locations and in places and in a thoughtful way. Okay, so now we're going to say, like, how will we know, how will the change be an improvement? Well, we'll know it's an improvement if they have greater knowledge, they're connected at the end of the program, pre and post tests, evaluation, and in program discussion, right? So regular attendance will improve their knowledge and connectedness. What changes can we make? So this is where we sit down and we brainstorm. We're like, what can we do? Like, what's going to work, right? So let's say our team comes up with 10 ideas and we rank them. There's all kinds of facilitated processes that you can use to do that. In our Change Leader Academy, we walk through how to do one of those. That's really helpful in prioritizing the changes you want to make. So the changes are, let's say we identified increase the number of, sorry, I have to move this. Increase the number of reminders in advance. So we're going to remind people in advance more than we have been. We're going to provide clear directions to the location, including parking information, and we're going to move the time by an hour. Those are the 3 things that we think will help. So we're going to run some of those changes. So this is the 3 questions, right? This is I cannot advance slides. These are the 3 questions right here. We've answered our guiding questions. We know where we're headed. And now we're going to go into that testing cycle, and we're going to do a couple of cycles here together. I'll walk you through one. So one of the first things we said was we want to increase the number of reminders. So our first cycle, we're going to test email reminders. And we decided we don't want to test this by itself because we think this could be powerful. We're going to send emails for upcoming session 3 days and 1 day in advance. Okay. How are we going to do it? So we're going to have the session facilitator send an email to all participants with the information about the upcoming session, and we're going to send the emails out 3 days and 1 day in advance. We're going to include, you'll see, really specific what information is going to be included in there. So that's the do. So this is what is happening. They're doing this. The emails are going out 3 and 1 days in advance. They include this information. And now we want to know, well, what happened? And this is where I think we look at different measures that we've talked about. So we see attendance records showed an increase in participation and on-time arrival. That's awesome. We showed an increase in regular attendance, meaning repeated attendance, up to 65%. That's not quite where we were headed. But I want to point out the balancing measure here, which is an additional hour of staff time per session was spent to prepare that email. So thinking if we have 10 sessions, we're looking at 10 hours of time potentially. Maybe it gets faster as we go along. Maybe we can find some improvements there. But we want to make sure we're looking at that too. What's the other impacts of that change? So how are we going to act? What do you guys think? We've seen an improvement. We've seen some increase in those staff changes. What do you think? Write in the chat if we should act, adopt, abandon, change lanes. What do you think? No opinions? Adapt. Time's a big factor. Yeah, you got to think about that. Act, adapt, adapt, adapt. I like it. Adapt, act. So we're already acting, but are we going to adapt, adopt, or abandon? Automate the reminders. Okay, so we have an improvement to our improvement, right? I love that. So we have seen some improvement. And so I'm hearing a lot of adapt, keep the reminders, but reduce the amount of time. So I think we're going to say, when I was looking at this, I think let's continue to do this, but I think you're right. Let's think about automation, and that'll be another improvement round. Let's think, okay, so we're going to continue to send out these email reminders because we've seen a 10% jump and people are showing up on time. So this is going pretty well. So our next cycle, we're going to send text reminders. Who reads their email? Am I right? We're going to send text reminders and we're going to see if that reduces the time or gives us that jump that we're looking for to that next level. So our plan is to send text reminders the day of the session and remind people. And so for our due, right, we're going to text message the day and let me sorry, let me back up. We're going to text the day of the session, but there's an important caveat here, which is we're not going to text people who've stopped coming, right, or people who never showed up. We don't want to irritate people. So we're going to send this text message to those people who attended at least the first session. Maybe they've missed a couple, but they came to that first one, so we're going to keep texting them for a while. And the information is going to include the reminder, start, end times, and location. So we're not including that agenda because that's too much information for a text. We're not sure it's getting people there. But we're going to go ahead and do this same day text and see how it goes. So when we study it, we're going to look for these same measures. Did we see an increase in attendance and on-time arrival? And what was the balancing measures? So the attendance increased to almost 80%, right? So we went from the emails took us to 65%. These text reminders took us up to 80%. So we're really getting somewhere now. And an additional 2 hours of staff time was to set up the text software and only 10 minutes per session to send them out. So that's something. What do you guys think about that balancing measure? What do you think about that as our next? What do we do? Adopt, adopt, adopt. So many adopts, right? I think this is great. So yeah, we're going to continue doing this. We got to where we were going. And you can see we documented this. These are really just, the bullet points of the findings of what we did. But if you are having your staff keep track of this as you are doing it, keeping notes about, oh, I got a lot of bounce back emails that I had to deal with. The texts didn't go through. We got people who were mad at us. There's all kinds of information that you can find. And as you're asking the facilitators to kind of document the testing cycle. So are the measures in the study row only process or balancing indicators, or could outcome measures be captured in the study as well? So we could, but because we're doing small tests of change and we're doing them kind of rapidly, we're not going to probably be able to get to those outcomes. What we're going to do is say, we know from prevention science that parents who attend 80% of these sessions have an increased knowledge. We know that increased knowledge leads to better relationships and rules and boundaries about alcohol use among youth. And so we're gonna, it's we're doing our work better so that we get to those outcomes. But we're probably not going to have time to get to say, we saw a reduction in youth drinking because we sent this text message. Are we going to get more parents in the room? Yeah. Parents in the room equals better conversations with kids? Yeah. So we're getting there, but we're a couple of steps removed. We're really just working on these processes and the systems. So we're going to continue to do that. I say, let's keep sending emails. Let's keep sending text messages. Have we included people who have agreed to receive text? That's such a good question, right? These are things that need to be addressed, and it's why you have a team. I hadn't thought about that. If I'd done this by myself, I might have some angry people. Or, we might have no one wanted to receive my text messages, right? So there's all kinds of important questions that need to be asked about the implementation of this. So Kathy, thank you for that point. Those are questions that we can't answer in the abstract, but are things that need to be considered. And again, it's why you work with a team. Other questions or thoughts about? Right, I love getting an email and a text. I mean, I like people to recognize that I am forgetful. Thank you for that. So you do, Kathy, you asked that question, is it okay to receive a text? I think it's an important one. And if people say no, then you know that that's not an improvement that's going to work. So that's going to be a real quick cycle, right? 70% of people didn't want to get a text. Perfect. And that's why we call them rapid tests of change. It's why we list more than one change. It's why we don't stop at that one idea. Okay, so we've improved our program. Yay, us. And we've already kind of started having this discussion, but and you've already shared with me some of your thoughts and questions or insights, but is there anything else before we move on? Okay. I love that we're all forgetful. I love that example because we are all forgetful in our busy lives. So it's one of my favorite examples. Okay. So what were the three? Abandon, adopt. So we're just going to do it like we said we were going to do it. Like we're just going to keep doing those text messages exactly like we said. Or adapt, which is we're going to run this test again. Yeah, we're going to run this test again, but we're going to change it a little bit. So we're not going to text them the day before. We're going to text them the day of, for example, would be an adaptation. Find more ways to connect, right? So that would be a new change. Okay. Any other thoughts about that PDSA cycle, that documentation, how we go through that? And those boxes are the same ones you're going to find in that worksheet that we have for you. Okay. I want to dig into a little bit more about how this works in the spiff, because we've been talking about implementation, which I think is really the place where it fits really neatly and is easy to wrap our brains around. But we can improve all of our work, and we can improve the way that we do the spiff with quality improvement. Excuse me. So in the assessment process, we can ask ourselves, these same questions about how we can do our work better. We're going to be curious about our spiff process, and we're going to ask, how are we doing and how can we do it better? So are our data still relevant is a great question to ask. Are the needs still the most important ones? So we're asking those questions, and then we're trying to find out how can we improve making sure we have relevant data? How can we improve the assessment process to make sure that we're getting the information we need or that we're analyzing it? So there's all kinds of processes that happen inside that assessment phase that we can start to think about. And as we go through this, write in the chat a question or a process you might think about changing or improving in each of the steps of the spiff. So for an assessment, I might say, can we improve our assessment process by bringing in an outside data analyst, and we could test that change. So there's all kinds of different ways that we can think about it. Could we do it and have a more structured way that we look at the data as a coalition? We're going to keep moving through that spiff process, right? And we're going to say, capacity building. Do we have all the right partners at the table? What's our process for recruitment? How can we get people to the table? I mean, there's a whole process that we go through to recruit coalition members that we don't even know is a process. So we can break that down and look at those systems and say, how do we get the right partners here and improve that? Do we have adequate internal capacity? Do we have the funding? Do we have the infrastructure, technology, the people to do the work? And if we don't, how can we work towards improving that? In planning, I see we have someone who's already said, can we involve others in our planning? So are our plans adequate? Do we have the right partners involved? It's exactly, are the right partners at the table here? Um, oh, no, that's the wrong one. Sorry. Do we have the right partners involved? Do we need to adjust our priority outcomes? If we do, how do we improve that process? How do we adjust those priorities? And again, thinking about the ways in which we do that work. Excuse me. I was looking at the next slide, which is, are our plans, are our evaluation plans? You'll see I skipped implementation because like the entire time we've been talking about implementation. So I just skipped right over that and went to evaluation. And what were our plans adequate? So did the evaluation plans work? Were there problems, or are there problems with ways that we could gather information better? We can look at it better. Do we have the right partners involved in that planning? Did we reach our desired outcomes? Are all some of those questions around improvement that you can ask. So every step of the SPIF has a way that we can improve our work in it. It just so happens that it fits really nicely into the, the implementation phase. So thinking about all of this, how do you think you could apply CQI in your prevention work? And you can just take a minute to type that in the chat. And as we do that, I do want to point out that this is not as easy as it seems. Like I just made this seem like it was easy, breezy, lemon squeezy. And it's much more challenging than we made it sound. Yeah, so thinking about asking the right people to participate will definitely help in your work. So I know this picture, right? This guy's just climbing an ice wall. That's fine. Good job. That looks easy. I'm guessing it's not as easy as it looks. And some of the challenges that are going to really make that we're going to have to think about in advance with quality improvement is making one of the biggest challenges is kind of a lack of administrative or leadership support. We're going to make sure we have that on board early, that we have our supervisor, our funder on board to help support that change because they can remove barriers. Um, Staff turnover can be a big challenge. And that's why I talked about like documenting, so that if there's staff turnover, that you don't lose that momentum that you've made because you have it written down somewhere. You know, I want to go back to that idea, right? We have square wheels and someone's offering us round ones, but we don't have time to change that. It's true that we have a finite amount of time. So having administrative and leadership support will help you say, I need more time to do this. Can we free up some time? Can we bring in some support? Making that time, but time is one of the biggest challenges to doing quality improvement work well. Just the capacity to collect and analyze data can be a big barrier. Those aren't the skill sets of those of us necessarily who went into prevention to make our communities healthier. We didn't, we may not have that within our coalition. Do we have it in our organization? But that can be some of the challenges logistically around how do we get that data, look at that data. Fidelity concerns are going to be an issue, and you're always going to want to be thinking about this, right? You always want to be thinking about, if I make this change, am I impacting the fidelity to the model? If I'm doing a youth prevention education program and I want to make an improvement, does that improvement step on the toes and change the program too much so that I'm not implementing with fidelity? Can I do all the things we do on fidelity checks? Can we talk to the developer? Can we make sure we're looking at core competencies? Can we ensure that we're not making changes that will substantively change the program? So we just have to make sure that any changes that we make or improvements, that we're considering the fidelity to the model. these are the things we have to kind of take into consideration. And so when I say, oh, let's just do this, it's not that easy. I also want to just acknowledge that like one of the most important things we can do is create a culture of change. If your leadership is on board, if you have a team, um, then and you have a clearly defined idea of success, you can start to really build this culture inside your organization that values improvement and values change and becomes more and more dynamic. And you can be the people that lead that, fostering open systems, involving stakeholders, really valuing that inquisitive, curious approach to your work. So I encourage you to think about how you are a change leader. And again, that Change Leader Academy that's coming up in the spring is a multi-session process that we talk about how to do that. I have talked so much. I have really enjoyed all the participation as well, but I'm really curious now to see if I was successful and if I can continue to improve. So I'd like to go ahead and just put those questions back up and ask you to take this post test. If you did not take answer these questions in the beginning, please don't answer them now. But we do ask that you take a minute to go through these 4 questions. Again, not a test of your knowledge as much as it is a test of how well we were able to communicate these ideas around quality improvement. And while you do that, I just want to, take a pause for questions, thoughts, insights that you might have or want to share with the group as you take that minute. Anything else? So the issues or barriers to using this model again are things like time, getting people on board, trying to get people into the mindset of change and being open. So it's that curious, open approach, and I think those can be some of the barriers. Have other people on the call, if you have used even informal quality improvement, have there been barriers that you've experienced? I know the barriers I've experienced personally have always been around a lack of administrative support. Like we don't have time to do that. Aaron, just let it be. um, and it's a time and just having the right people on board, I think, can be the biggest challenges. Any suggestions for record keeping to ensure this knowledge remains within the program and not within individuals? That's such a great question. And I think it's different for everyone based on how their organization works, but keeping shared files, using those structured worksheets. So like the worksheet that we provided, but there are other tools out there. There's whole workbooks on documentation. So making sure that if you use the formal process that you document the formal steps, and having a team that includes leadership, includes participants, includes everyone throughout, each level of the organization, not everyone in the organization. People at each level also helps to ensure that it remains within the program or the organization, because by involving leadership and by involving those decision makers, they're more likely to be paying attention to that moving forward. If that's clear, I hope that makes sense. But buy-in from leadership is one of the most important components. Great. Other questions or thoughts? Because I do know that we have other things going on in Great Lakes PTTC, and I want to make sure that we get a chance to hear about those.
All right. You want me to go ahead and jump in, Erin?
Yeah, let me just stop my share.
Okay.
Thank you so much.
All right. And folks can continue the post test as I am talking. We just want to make sure that you know about a few things coming up with the Great Lakes PTDC. And of course, definitely what we want to highlight is the Change Leader Academy. So if you're wanting to learn more about how to do this and put this into action, join Aaron and Scott. It's going to be in March. Enrollment is limited to Region 5. We will take a wait list of folks outside the region. So if you're outside of Region 5, we can put you on a wait list. And if we have spaces available, we will accept you in as we can. We also are starting our deep dive into prevention ethics coming up the first Thursday in January. So be sure to sign up for that. Risk factors for youth substance misuse. I'm going to lead that webinar. I hope you will join me. We have a good group of folks, very large group of folks already signed up. Hope you can join as well. If you haven't signed up yet, be sure to do that. Make the magic happen in a meeting facilitation skills. This is full and we can't accept any more folks in. I've had emails saying, can you accept, open up more slots? We've maxed out Zoom for this. So there's just no way for us to do that. So we did just open up we're going to repeat it on July 23rd. So if you go to our website and scroll down to July, you will see that you can sign up for that session if you're interested. Wanted to let you know we have a new date for our drug trends webinar that's going to happen in February. We originally were going to do it in January. So if you had that on your calendar, be sure to switch it to February. Registration will be opening soon for that. Our virtual SAPs, we're getting close to full. This is limited to only those folks in Region 5, but if you're wanting to participate in that, I encourage you to sign up as soon as possible. This will be the last time we are offering a SAPs for this fiscal year, which is through September, end of September, and this is the last year of our grant. So hopefully we will be around. Hopefully there'll be reapplication and we'll be around for another iteration, but at this time, this is the last SAPs that we know of that we can offer. So be sure to sign up if you're interested. And if you aren't already, please like and follow us on LinkedIn and Facebook, depending on where you like to do your social media, or perhaps both. This is where we can put all of the information that we get in from other sources that we think might interest you all, and also for any updates, like when we changed the time of this webinar, we put it up there, as well as, of course, we emailed folks who were registered. And last but not least, please take time to complete our evaluation form. You will be redirected to the form after this webinar is closed out. This is how we can report back to our funders what we have done. But more importantly, in my mind, in terms of continuous quality improvement, this is how we continue to improve what we deliver to you all. I read every comment that comes through, so please know that it's not just going off into some void that nobody ever reads. I do read it. We take it into consideration as we are looking at how to implement our training events in the future. So please take time to do that. And with that, thank you very much. A huge thank you to Erin for presenting this webinar and pulling all this information together, creating the worksheets for you all. There's a job aid that Erin created for you. All of those things are up on our website, as you have seen in the chat many times during this webinar. Thank you to you all for your participation. And Erin, any last thoughts?
No, thank you so much. And in the follow-up email that Rebecca sent out, she'll also be including some links to a cheat sheet on how to do Smarty goals. I also have a quality improvement workbook. It's focused on healthcare, but it's a great workbook resource that will include in there as well for you guys to access.
All right. Thank you so much. And everybody have a wonderful rest of your day. Bye-bye.
Bye.